Hi, Era. My name is Arnold Liglipa. I have a consent, and then is it okay? I'll get your treatment today.
Yes.
Okay. So now let's go start for structural assessment. So first is body reading. So now I'm looking for anterior. So okay. So your chain is going to the left, and then your head is going to the right. Okay, and now your knee is lower left than to the right. Okay, can you move to the? Can you rotate to the right, to the left? Okay. Okay, it's normal. Can you rotate, please? Okay, so yeah, there's your spine is lordosis, little bit lordosis, and then your PSIS is lower than the right, and then your antalgic. Okay, can you rotate to the left? Okay. Okay, looking for T lines. If there's something wrong. Okay. Normal. Okay. Can you back to the normal? Okay. Now, next is I'm going to test your stroke test. Can you move your face to the wall, please? Okay. Or in here. Okay. So now, so I'm. This is the assessment for the stroke test. So I'm going. Okay. I'm going to palpate the ASIS first. Okay. I'm going to. Okay, so just to make sure, can you lift your knee on the left, please? Okay, and back to the normal. Can you lift to the right, please? And back to the normal. Okay, this is the right spot of your PSS. So now I'm going to locate the S2. So from here, this is your L5. And below that is S5, S4, S3, S2. Okay, now I'm looking for the stroke test. I'm looking for the inferior movement. Okay, if it's stuck, so there's something wrong. So now, can you raise up your arm? Okay, lift your knee on the left. Okay, back to the normal. Okay, the other side, please. Okay. Back to the normal. Okay, it's normal. There's nothing wrong. There's no asymmetry. Okay, next is like a supine position. This is the structural assessment. So can you supine too? I'm looking for the assessment for the CCP, the common compensatory pattern diaphragm. Okay, so I'm looking for the ease of the, okay, ease, and then EO. Okay, full reflection. Okay, I'm looking for the ease. Which side? Okay, rotate to the left and rotate to the right. So yeah, on the right side is ease. Next is the I'm looking for the, okay, TL. My hands in the scapula, their scapula. So I'm going to lift the left. Going to the right, looking for the ease. Okay, next is rib. Okay, rib movement. Okay, is it okay? This one, okay. Okay, this is my palm is flat, so the fascia it should be glide. Okay, glide to the left. Name for the TL, okay, the rib upper C7 to 10. Okay, can you inhale, exhale, inhale, exhale, next is the alternative. Okay, the ALS. So I'm looking for the ASIS, and then the pelvis. So I'm going to rotate. Okay, this is LS alternative. So my arm should be flat. Okay. So can you touch your pubic tubercle, please? Is it okay? Can I touch that one?
Yes.
Okay. Can you remove this one? Okay. And then I'm going to, my palm is flat. I'm going to fascious glide to the left, to the right. Okay. So next is front position. So can you do the front position, please? Okay. Next is a pelvic diaphragm. Pelvic diaphragm. Okay. Should be my palm is flat into the glutes. Okay. The glutes, and then to the lateral sacrum and into the ischial tuberosity. Okay. So I'm going to do this one. I'm going to do this. Next is sacral movement. Sacral movement, I'm looking for if there's a counter notation, or if there's any symmetry. Okay. Can you sit down, please? Yeah, sit down. Next is functional assessment. So I'm looking for texture of your skin. There's slightly rough, and then your tone it's normal. There's elasticity. It's when comfort it's like less elastic than to the left. Tenderness, your pelvic it's more. Okay, I'm looking for local listening. So that your partial drag towards to superior to the lateral. Okay, next is to treatment from global to local to focal. Okay, so next the first thing I can do is I'm going to treat your global first.
Okay.
Okay, so can you do side lying, please? Side lying. Okay, so I call it like the lumbar roll. So the lumbar roll, so my arm is like into, okay, under my forearms, like under her forearm, and the other forearm is into the lateral of the greater trochanter. So what I do, like full, slightly full. Okay. Okay. There's another treatment. So the legs is like off the table. Okay. Same thing. So the forearm is like under her forearm, and my forearm is like to the lateral of the ischial greater trochanter. Four, Can you go to the other side, please? Side line. Here. So now, same thing. My arm is like the thoracolumbar fascia, and my forearm is like into the lateral greater trochanter. Okay, there's another treatment. The legs is like the table, and then same thing. My arms like putting into the thoracolumbar fascia, and then my forearm is the greater trochanter, lateral. Okay, next is, then I'm going to reassess. Okay. There's any discomfort now? No discomfort? Okay, that's good. Okay, okay, now next is local. So local, it's a glutes max. Okay, so the glute max, can you do the prone, please? Prone. Thank you. Since you are a pectoral size on the right, so I'll do start on the right.
Okay.
Okay. So my my palm is on the lateral of the sacrum. Okay. And then my another palm it's on the latissimus dorsi. That's it's and then this is contralateral. Okay. This is indirect. Okay, I'm going to push inferior to the superior to the inferior. Okay, there's another test. So, sipping glute. So, my palm is in here. So, okay, close to the lateral sacrum. Okay, and then I just move in here, 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 here. Okay, there's another treatment. Okay, so I'm going to the extend, abduction, adduction, extension, flexion, flexion, abduction, adduction. Okay, let's go to the other side. We'll do the same side. Okay. Okay, my palm is on the glutes, close to the sacrum, lateral sacrum, and this is like contralateral, contralateral. Okay. Going to superior, to the inferior, superior, inferior, and we can do the FC lateral. Okay, superior, superior. Okay, let's do the shaping shape. Okay. We can do that flexion, abduction, adduction, flexion, abduction, adduction, and then reassess. We're going to reassess. Always reassess. Okay. Do you have any pain or discomfort?
No.
So next is like lumbar decompression. So the lumbar decompression, can you please?
Sorry.
So yeah, the lumbar decompression, it's good for if you have sacrum, probably the sacrum, the glutes, lower back. This is what you gotta do. Since you are probably on your right, so I'll go to the right. Okay. So can you lift this one, please? Okay. Okay. My palm is like I'm going to put on the under the sacrum. Okay. Can you lift your pelvic, please? Okay. Sacrum. Okay. Okay. And this one. Okay. Can you straight this one, please? Okay. And this one, I'm going to put, where's the airplane? This one is like from, I'm going to, that's from L4 to L5. Okay. It's like sink in. So what I'm gonna do, my other palm to the sacrum is like pulling to the inferior into the other arms, like pulling to the superior. Okay. Let the fascias like loosen. Okay, now. Okay, this is good for lower back, anterior tilt, sacrum problem. You feel it? Okay. Next. Okay. So next is we can do the focal as well. It's pelvic floor diaphragm. So the pelvic diaphragm is like my other arms like, can you lift your putting the sacrum? Can you lift your pelvic, please? Okay. Going to put to the sacrum. Okay. Can you down, please? And then my other palm is like, okay, where's your going to touch it? Thank you. Can I touch this one? Okay, the other arm is like putting to the pubic symphysis. Okay. So this is indirect glide first and then superior, looking for obstruction or fascia. Lateral. And after this, always reassess. Okay, reassess again. Going to reassess. Okay, relax. Do you have any discomfort now in your pelvic floor? No. So now I'm going to assess as well the lumbar decompression. Okay, can you hit this one? Okay, and then any pain?
No.
So this is the treatment from global, local to focal. So now it's can you sit down please to the normal. So I was taking your blood pressure before, which is normal 3 times, left, right, and left. So now there's a contraindication. So contraindication, if there's a joint pain and your scoliosis, yeah, and there's an inflammation, infection, there's a and see you in the next 2 weeks.
Okay.
Thank you so much.
Thank you.
Yeah.